Good evening, and thank you so much for joining us for this week's Community Leader Call. My name is Tomas Talamonte, and I'm Deputy Chief of Staff to Mayor Muriel Bowser. I want to thank you for joining us for tonight's call and joining us every week as we discuss the district's response and recovery efforts related to COVID-19. Want to remind everyone about a few housekeeping items before we get started with the call. If you have a question, you can press 0 now to be entered into the question queue. We are also streaming live on channel 16 and the mayor's social media accounts, as well as Mayor.dc.gov/live. If you have a question that you would like to ask, if you're not on the phone line but watching us on one of those live streams, you can also ask your question on the mayor's social media accounts, and we'll get to those as well. So again, if you have a question and you're joining us by phone, you can press 0 now to get entered into the question queue. Want to remind everyone again, for the most up-to-date information and resources related to the district's response and recovery efforts on COVID-19, you can visit coronavirus.dc.gov. Again, that is coronavirus.dc.gov. Today, we will be joined by a few representatives from our agencies to answer your questions. First in person here with us at 4 is Director Christopher Rodriguez. He is the director of the DC Homeland Security and Emergency Management Agency. We're also joined on the line by our city administrator, Kevin Donahue. We're joined by Patrick Ashley, who's Deputy Director for DC Department of Health, and we're also joined by Dr. Preetha Iyengar, Supervisory Epidemiologist at the DC Department of Health as well. So we want to, again, thank you so much for being here with us, and before we go into questions, want to remind everyone, again, just real quick, that you can press 0 now to be entered into the question queue. As always, want to remind everyone, if you have not completed your census, as we wait for the questions to come in on our form, if you have not completed the census, we hope you will do so. It's a great activity to do tonight. If you haven't done so, just by going to 2020census.gov, we want to make sure that every resident in all 8 wards is counted in the District of Columbia. So please make sure, if you have not done so already, that you go. That you press 0 go to census, 2020census.gov to complete the census. So again, if you have not pressed 0 yet, you can press 0 now, and we will be able to start answering some questions. Our first question is coming online, and this is not COVID related, but for Director Rodriguez. It's a question for residents that may have experienced flooding over the weekend or over last week's weather event. How they could, where they can process information if they've had flooding. Is there a place where they can file a claim? Where's the best resources for that if they experience that over the weekend?
Well, thank you for the question. And we did have a significant rain event on September 10th, the largest accumulation of rain that we've had in the district since 1950. So, and we know that there are some communities within our city that have been severely impacted by the flooding and the water. The district has been working very closely with DC Water. As you know, Mayor Bowser toured some of the sites that were severely impacted and neighborhoods in Riggs Park and in Edgewood over the weekend. The Mayor's Office of Community Relations and my agency, HCMA, also canvassed some of those neighborhoods on Sunday to make sure that residents had the information that they needed. So what we would ask residents to do first is if you are in Riggs Park or Edgewood and received our flyers, please fill out the damage that has been done. It will help feed some of our damage assessments for the event. But also DC Water is having a virtual town hall tonight at 6:30. And I would encourage any residents who have questions for DC Water about how to file a claim or any of the steps that they are taking to mitigate and to help remediate some of the damages, that would be the appropriate place to ask. And we will have representatives from HCMA on that line as well so that they can answer any of your questions. So thank you.
Thank you, Director Rodriguez. So again, to remind everyone, you can press 0 now to be entered into the question queue, or you can ask your question on the mayor's social media platforms on our live stream. So if you're watching there, feel free to ask your questions there. Our next question is going to come from Eric Traeger in Ward 3. Eric, your line is unmuted.
Yes, hi. Thanks so much, and thanks for doing these calls. We have been home with our children these last 3 weeks implementing distance learning, which is a completely inadequate form of education that's pulling working parents and many grandparents away from their jobs. And we read today that the convention center will be opening. So why is the convention center opening when the schools are still closed? And what types of events, what size will you be allowing? And if it's okay to do that, why are the schools still closed? Thank you.
Thank you. This is Chris Rodriguez. So some of the activities at the convention center are going to be very controlled in terms of some of the COVID-19 guidance that has been written and conveyed by DC Health and by the CDC. So very limited activities, again, all within public health guidelines that DC Health has laid out, and consistent with federal guidelines as well.
Great. As City Administrator, I don't know if you want to add anything to that.
I do. We have the goal of being able to begin some kind of in-person instruction at schools in time for the transition to the second term at DCPS, which is on November 9th. And we're going to work very hard to prepare for that. We also are committed to trying to identify ways to allow for some kind of in-person experience to supplement some of the virtual learning in advance of November 9th. We are working closely with DC Health to follow guidelines and to make sure we have the right equipment and procedures to be able to do so safely. So we're going to be working very aggressively to get there during this calendar year.
Thank you, City Administrator. Our next question is for DC Health. The question is coming from online, one of our live stream viewers. If DC Health is testing wastewater for COVID, seeing that other counties in the area are doing just that, and wondering if DC is testing wastewater for COVID. That question is for...
Hey, this is Sweeta Iyengar from DC Health. There are not any wastewater surveillance programs being implemented in the district at this time. We do have pretty good coverage with our testing. So we think with our surveillance data, we do have a good sense of what is going on in the district with respect to COVID infections. But there are no plans for that at this time.
Thank you, Doctor. We're going to go next to Jay Haddock from Ward 6. Jay, your line is unmuted.
Hi, thank you for taking my call. My call was because of the length of that we've been in Phase 2 and entering the new fiscal year. Will the district be reforecasting their budget for 2021 based on the issues dealing with hotels and restaurants and so forth?
This is Kevin Donahue. I can jump in. The CFO for the district will be. We're expecting a revenue estimate for FY21 by the last week of September. They have to get past September 15th, which we have just passed, to be able to get a sense of some of the property tax revenue that the city has. And then that will give us guidance as to whether or not the city's revenue will have to be adjusted within that budget year of FY21.
We're going to go next to Sherry Freeman in Ward 7. Sherry, your line is unmuted.
Good afternoon. My question was being pre-screened, so I didn't hear who was on the panel, but I did hear a school-related question answered, so I'm going to jump out there with mine. First, I'd like to say I am a 64-year-old retired grandmother. I retired in 2015. And I was enjoying my retirement up until school started. And my daughter and son-in-law are full-time working parents. So I am now caring for their 3 young children while they're working. One is pre-K 3. She's 3 and will be 4 next month. The other is first grade, 6 years old. And then I am potty training their 2-year-old sibling. With that said, I know the moving target date to get the students back in school is November 9th. And I say a moving target date because that may not happen. But what is being done to ensure that it's safe enough for the students to go back to school on that day, not just the students, the teachers as well, and more importantly, what is the teachers' motivation to get back into the classrooms? I believe if their union tells them that it's not safe to go back, then they likely won't go back. And if they don't go back, of course, the students don't go back. And if the mayor decides to follow the lead of Prince George's County again, they've already indicated they were bringing their students back into February. For D.C., that means a lot of the teachers live in Prince George's County, and they will cry about having to come back to their job while their children are home in Maryland. It's a long question, but I'd like to have every part of it answered.
Ms. Freeman, thank you for your question. We can go to the city administrator first. City administrator?
Yeah, why don't I? So that's a really outstanding question that does highlight all the puzzle pieces that are really bound together, including the regional component of decisions that we make in the district. I'll start with the first part of your question, which is the mayor takes her guidance around the safety of reopening for both students and teachers from DC Health. And the city had been planning to have some kind of reopen, perhaps in a hybrid setting, earlier in the year. And when the DC Health forecasts a level of the virus in the city that required a pushback, we did it. So we're driven by the science, and I think we've demonstrated a willingness to change, as you pointed out, the moving target as information about the prevalence of the virus changes. So the target now is November 9th for some kind of in-person instruction. I say some kind because there's different forms it can take, and we're assessing the educational merits and safety merits of those forms, whether it's 2 days on, 2 days off, or different variations of it. The second component we look at is what are the safety requirements that are needed to be able to minimize the risk to both students, families, and teachers. And there's actually some interesting and good guidance that was published yesterday by the CDC, which is, if you Google CDC school guidelines, I think it was the first link it pops up, that does provide some guidance that's not binding, but is informative to jurisdictions around both the metrics that one might use to assess that decision, as well as the precautions in place around things like sanitization and cleaning and hygiene and social distancing that are needed to do so. So our DC Health works closely with other jurisdictions to be able to formulate, well, what do we have to buy? What do we have to do from a process standpoint? What precautions do we have to put in place to be able to minimize the risk to both groups? The third part of your question, and I apologize for getting parts of it, which is there is a regional component of this. And so if you think about the two of the constraints we have, if we could address all the safety concerns, we'd still have class sizes that are much smaller than what they would be for full in-person instruction. So there's a number of just classrooms we have in a building that will provide some definition about how many we can have in there at one point in time, given smaller class sizes. And then there's how many teachers that we can bring back. And there are teachers that genuinely probably can't come back for health reasons. And there's those that can't come back for childcare or other COVID-related reasons that may not relate to their health. And then there's those who both want to come back and can come back. And I think that there's a much larger number of teachers than maybe a lot of folks assume that want to come back, and we're looking at ways for those who want to be able to provide some accommodation where we can to boost those numbers up to the point where we can make as much use of all those classrooms as possible. Recognizing even when we do that, because we have smaller class sizes, we have to make sure we innovate and improve and adjust the virtual learning experience because that's going to be part of schooling for even after we have some form of in-person learning. And just the very last thing very quickly is you pointed out, I think quite rightly, that not all students are affected the same by virtual learning. It is not the same as in-person learning for everybody, but it's more challenging for some, particularly our younger learners, who being virtual is just going to be a bigger challenge. And so we're also looking at recognizing those differences in how we prioritize reopening. So thank you for the question, highlighting all the different moving parts here.
Thank you, City Administrator. I want to remind everyone again, if you have a question, you can press 0 now to ask your question, or you can ask on any of the Mayor's social media platform live streams. We have time for just a few more questions, so I want to make sure that if you have a question, you get into the queue now. We're going to go to Jacqueline Mears in Ward 2. Jacqueline, your line is unmuted.
Thank you. My question is regarding gyms in the city, and given that the prevalence of this virus is going to be long-term rather than short-term, and that a lot of us depend on our gyms, what can the government do in the way of mandates to mitigate the problem of indoor exercise? Because this is a real problem that is affecting muscle mass, all kinds of things. Exercise is key. So and this has already been 4 or 5 months now. That's my question.
Thank you, Jacqueline. That's a very great question for our epidemiologist that's on the line, Dr. Preetha, who's been a lead on a lot of our DC health guidances. So, Preetha, do you want to take that response?
Sure, yeah. Thanks so much. So we have actually been, again, working to develop guidance documents to allow gyms to open safely, and we've given a few webinars as well to gym owners as to how best practices can be implemented. I mean, DC actually opened gyms in phase 2, which is earlier than some areas, and so has the restrictions in place that we feel are needed so that people can exercise safely indoors and that classes can be safely had outdoors. And we do appreciate that will also be an important need that needs to be addressed as we move kind of into the cooler months moving forward. So that has been, I think, a priority for us to make sure that people are able to kind of be healthy in the middle of this crisis. And so we've developed the guidance around that.
Thank you so much. And I want to remind everyone again, for all of our DC health guidances, you can visit coronavirus.dc.gov /phase 2 for the phase 2 related guidances. We have a gym guidance up there, as well as mass gatherings, restaurants. I mean, all of our guidances are up there. We also have different documents for restaurants and business owners that you can post at your establishment as well. So I know we have a new restaurants document up there with the different sort of guidance for patrons on what they need to follow when inside of restaurants. For any restaurant owners on the line, we hope you'll print that and put that up in your establishment. I know that was a request from a lot of you on one of our past calls. So we just want to thank you all so much for for visiting coronavirus.dc.gov/phase2, familiarizing yourself on the guidances, and making sure that that any of our materials that we have there for business owners, we hope that you'll download them, print them, use them as well. We did get a question from Vincent on our live stream about the preparations being made for field use. If recreational sports leagues, little leagues will be able to participate in those activities soon. So we can go to Dr. Rodriguez for that question.
Thank you for the question. I also defer to my DC Health colleagues in terms of when the public health environment is ready for those types of activities. But we are looking at ways in which some of those activities can be turned back on in phase 2. But again, what we want to make sure that we're doing is abiding by DC Health's public health guidelines. And if we were to reopen those types of activities, how do we ensure that some of the higher contact sports like soccer, basketball, or football can be done in a way that's safe for children and for adults as well? So, thank you.
Thank you, Dr. Rodriguez. I don't know if DC Health, if you had anything to add on that.
No, it's lost. I think that's.
Yeah, I think. Sorry. Yeah, I was going to say. I think we just. I think we're finding things opening according to like the standards that we've set up for phase 2, and so open to looking at options that can kind of allow some trainings and things to occur.
Thank you. We have one more question from our online stream viewer, just wanting to know where we're at with testing turnaround at the current public testing sites, what that time frame is now.
Yeah, thanks, Tomas. This is Patrick from DC Health. We've made significant strides with our testing turnaround time in the district. We're seeing that we're getting results back in just a few days. But it's important to remember that those times aren't guaranteed, and that it is in everyone's best interest to be working with your healthcare providers for getting tests, especially if you need tests for specific needs like travel or procedural testing as well. So we, thanks.
Thank you, Patrick. We have another question from our online stream, I think for DC Health again. Just where residents can find more information about vaccine trial participation and just where they can get more information related to that.
Yeah, so there's a number of different vaccine information out on the HHS website that provides information on where that they can participate in the vaccine trials. It's also a great time to remind folks that it is flu season and that we should be considering getting flu vaccines from your local healthcare providers as well as we prepare for a flu season.
Great. Thank you so much for that, Patrick. Just making sure we have not missed any questions on our live stream. It looks like in the queue. So looks like we're going to finish a little bit earlier this evening than we have in the past, but want to thank the city administrator, Director Rodriguez, and our DC Health team for being on with us this evening. Want to remind everyone again, for all the most up-to-date information and resources related to the district's response to coronavirus, you can visit coronavirus.dc.gov. We will be back here again next Wednesday at 5 p.m. To answer your questions. The mayor will also be hosting a press conference tomorrow morning So we hope you'll join the mayor for that press conference tomorrow for more up-to-date information on the district's response to COVID. And again, want to just remind everyone for these community leader town halls, we will be live streaming them every week, and we'll be providing closed captioning and ASL interpretation. So we hope you will join us every week, Wednesday at 5 p.m. We thank you, and thank you everyone for being on this evening. Have a great evening.